Hello, my name is Susan Al-Suqi. I'm a community health specialist at the Fairfax County Health Department focused in HIV prevention. Today, I want to introduce you to Patty Meek, one of our public health nurses at the Fairfax County Health Department. And today, we're addressing sexually transmitted infections and focusing on STI testing.
Hi, again, my name is Patty Meek, and my pronouns are she and her. I'm a clinic nurse with Fairfax County Health Department, and I want to say that sexual health should be like any other type of health. We want to make sure that we're taking care of ourselves, very important. When you come to my exam room, it's very patient focused, which means I'm not going to lecture you. We're going to talk, and I'm going to educate, and it's also a confidential zone, and again, a no judgmental zone.
That's great. Thank you so much. Patty, how would you define an STI? Because I know some people would hear STD in the past.
Okay, so STI stands for sexually transmitted infection. It used to be called sexually transmitted diseases. I think they switched that because infection probably sounds a little bit kinder, a little bit nicer. This would be any type of infection you can get through sexual contact. Sexual contact is more than penile vaginal sex. It can be penile anal sex. It can be oral sex. And it can actually just be rubbing up against someone with your genitalia.
And when should you consider getting an STI test?
So anytime you have, like the first time you've had a partner, it's a good idea to get testing. Anytime you are switching partners, it's a good idea for you both actually to be tested. And if you have multiple partners, in addition, if you have symptoms, it's a good idea to be tested. However, it's very, very important to understand your normal. So, what I mean by that is when everything is going fine with you, go ahead and take a mirror and look at your genitalia. Make sure you know what your normal is. And this is for men and women, especially women, because we have a lot of moving parts down there. And then if you have, let's say, a symptom, which can be burning upon urination, it could be an unusual discharge, an unusual smell, discomfort, or just feeling something different down there, then take a look with the mirror. And if something else looks that it's not quite right, that's your second indicator that you need to go get tested. But the first one is anytime something's different down there, very important.
That's good to know. Thank you.
Mhm.
Why is STI testing critical?
STI testing is critical because it can impact your life in many ways. It can cause infertility if you have an STI that goes untreated. It can cause other problems. It can actually be endanger your life depending on what the STI is. So it's very important to be tested.
Thank you. What do most people misunderstand about STIs?
Ah, one thing is people think if you have an STI, you are going to have symptoms. And a lot of people do have symptoms. However, sometimes you can have an STI and have no symptoms at all. So that's why it's very important to be tested if you have multiple partners, if you have a partner, if you have a partner and you feel that partner has not been monogamous,
Mhm.
it's a good idea to be tested. So that's one of the big misconceptions about STIs, that you will always have symptoms.
Okay, thank you. And what can you expect when you come in for an STI test at the health department?
Okay, so first of all, I said it's a confidential zone. It's a non-judgmental zone. So we're going to ask a lot of questions about your sexual habits. And the reason we do this is for educational purposes. There are some things that you can do that will put you at more risk for certain STIs. We also do that because it also helps us treat you. So in addition to that, we might take what we call cultures. So depending on what's going on with you, if you have a discharge, for a woman, we would do a pelvic exam. And for a man, what we would do if you have an unusual discharge, we take a little swab and we go right into the center of the penis, the urethra. I know a lot of men freak out over this. They get scared because they think it's really painful. There are ways that we have that we can do this that makes it less uncomfortable. And then sometimes we also draw blood, depending.
Okay. Sorry, I was going to ask, how can you prevent STIs?
Okay. The best way to prevent an STI is to not have sexual contact at all. However, we're human. And let's be honest, sex feels good, especially if we're in an intimate relationship. So a lot of times we're going to engage. So one of the things that we can do is to use condoms and use them correctly. To avoid STIs, we need to be using latex or polyurethane condoms. Do not use sheepskin condoms. That prevents pregnancy, but does not necessarily prevent STIs. When you use condoms, also make sure you're using them correctly. Make sure you're checking the expiration date with condoms. If we have female condoms also, but for condoms that actually go in the male's penis, you want to make sure that you're only using water-based lubricants. So those are some of the best ways to prevent STIs.
Thank you. And what tips do you have for maintaining sexual health?
Open communications, of course. In any relationship we should have open communication. But I also think we should have regular testing. And I think we need to take the stigma away. There's this fear of, oh my goodness, I've had an STI, I'm unclean. It's like any other disease. You get STIs just like you get any other disease. There are a lot that there are cures for. There are some that there are no cures for. But even the STIs where there are no cures, there are treatments to lessen the effect of it.
Great, thank you so much. And when you were saying communication, how should parents communicate with their teens or with their
Oh,
kids?
okay, very important. I
Mhm.
think it's important for parents to talk to their children or their teens about sexual health
Mhm.
because children are very inquisitive, and we can also, I guess, control all the information our children get. They go to school, they hear things, and if we're talking about teenagers, they trust their peers. Peers are not always going to have the best information. So if you're a parent and you're not comfortable about talking about sexual health, like condoms and which should be, I guess, considered good sexual health, respect in a relationship, then find an adult who you trust, who has similar values, who has that knowledge, who your child trusts, who can talk to your child. In addition, you can use books. One of the things I did, I spoke openly with my children, but I found very good books and I left them in the house. I left them like in my son's room because I knew his curiosity would have him read that book.
That's great. I was also going to ask, what is like the window of time for an STI test, or what does that mean exactly?
Okay, so it's so hard to speak in exact terms because all of our bodies are different. And depending on the equipment that you have, the equipment, some laboratory equipment is more sensitive than others. The best thing would be about 2 weeks after you feel like you've been infected to
Okay.
come for testing. You can always come again if you feel like, oh, you have another symptom or you have a symptom that's not going away. It's
Mhm.
always a good idea to come for retesting.
Okay, great. And can students or teens come into the clinic without a parent, or how does that work for STI testing?
Absolutely. Okay.
Okay.
Yes, they can come into the STI clinic without parents. It's confidential. However, I will say that if a parent finds out that a child has been to the STI clinic, then we must inform the parent. There are specific procedures and paperwork that's done, and there's a waiting period, and then we have to inform them. However, it's a good idea, I think, for children to come into the STI clinic. I've had, I think, a grandmother one time who brought her granddaughter in to talk to me. There was concern about sexual activity, but it was a good way for that child to actually talk to someone. The grandmother was comfortable with my being in the room with her alone to talk to her from an objective perspective and a knowledgeable perspective.
Oh, that's great. And are there other services? Is there contraception available in the
Okay.
clinic?
In the clinic, the only contraception we have would be condoms. We have female condoms and male condoms. I wish that they sold female condoms in the drugstore, and they don't. However, you can get them on Amazon. I like the idea of female condoms because they cover more skin. It's a wider opening. You can use any type of lubricant with it. It can be oil based or it can be water based. So, those would be the two types of contraception and protection that we offer.
Okay. Thank you
Mhm.
so much, Patty. This was such a great conversation about getting people to come in and get tested for STIs and having them understand that there is no judgment. So thank you.
Okay.
I really
Well,
appreciate it.
thank you for interviewing me. I
Thank
appreciate it. I
you.
love what I do and I love my patients, so it's always my honor.
Oh, thank you so much.
Mhm.
I hope you have a good one.
Thank you. You too.